Good morning. Thank you for being here today. As of today, Idaho is still reporting no confirmed cases of coronavirus, but we expect confirmed cases at some point. As this map depicts, we're surrounded by states that are experiencing spread of coronavirus. We are prepared and we are being proactive. I want to share the latest on what we are doing to prepare Idaho for coronavirus. Given the magnitude of both the global and national spread, our focus is on slowing the spread for two reasons. First, to protect health compromised and elderly, and second is to preserve critical healthcare capacity. Dave Jepson, my Director of Health and Welfare and Chairman of my Corona Working Group, just assembled a strike team to protect health compromised and elderly. This is key to preserving healthcare capacity issues. The strike team is meeting regularly, and we will share more about that in a bit. Dr. Christine Hahn, our state epidemiologist, will also provide some updates on the Idaho situation. Idaho's public health officials and I have been tracking the coronavirus since January, when the first confirmed case was reported in the United States. To support the work of Idaho's public health agencies, I assembled my coronavirus working group, which has been meeting weekly and communicating daily. They are helping us to ask the right questions and focus our efforts on where it matters. We learn more about the coronavirus every day. We know that most people who contract it end up with mild or no symptoms, which reinforces the need for all of us to do our part to prevent the spread of coronavirus to those who could be more seriously impacted, the elderly with chronic underlying conditions and others with compromised immune systems. This vulnerable population is who we are seeking to protect. The coronavirus is highly contagious. If we don't all do our part to control the spread of coronavirus, then our health facilities will be overrun and patients will in a short period of time. If you look at this chart demonstrates what we are trying to address. If too many people get sick too soon, our healthcare facilities will not have the capacity to deal with it. We're trying to flatten out this curve by slowing the spread of coronavirus. Our goal is to preserve hospital capacity and keep our healthcare workers safe and healthy by slowing down the influx of patients into our healthcare facilities. How? By doing all the things that you've been hearing about. Wash your hands, stay at home if you're sick, avoid others who are sick. If you feel the need, avoid large gatherings and don't travel to areas with community spread. So, for these two reasons, to protect the vulnerable and to preserve hospital capacity, I am today signing an emergency declaration that enables us to do a few things. It increases our state's access to critical supplies, such as respirators from the national stockpile. It activates the use of Idaho's Emergency Operations Plan and makes funds available for use in the Emergency Disaster Fund. It allows me as governor more flexibility to expedite contracts and purchasing of supplies. And it allows for expedited renewal process for nurses who have retired or have left the profession to jump in and help the response efforts when that need comes. Right now, my focus is to make sure Idaho is as prepared as possible, and that is why I'm signing this emergency declaration. I also want to briefly address testing for coronavirus, because I know this is one of the biggest questions that we will get. People need to know a few things. If someone has a fever or a cough, they should contact their medical provider to find out if they should be tested for coronavirus. People without any symptoms will not be tested at this time. After ruling out the flu through a rapid flu test, a provider may take a sample from a patient and send it to a lab where the actual coronavirus testing occurs. Most providers can use a simple swab to collect a sample. Idaho is fortunate to have a state-run lab that can process coronavirus tests. The lab is keeping up on testing needs at this time. Dozens have been tested already, and privately run labs are ramping up to begin testing for coronavirus. I want Idahoans to know we are ahead of the curve. We are being proactive. We are prepared for coronavirus. We are communicating with the business community, schools, locally elected officials, the federal government, and citizens on a daily basis. We must not be alarmed, but we must be cautious. The old saying goes, an ounce of prevention is worth a pound of cure. Individually and collectively, we all have a duty to do what we can to protect the vulnerable and preserve healthcare access. Idahoans have always taken care of each other. Today, with this new threat, we must do more. I urge everyone to consider how you can help to your neighbors and your loved ones who need the support while protecting them from getting coronavirus. I will hand it over to Dave Jepson, who will discover the work of his strike team as well as the coronavirus working group. Dave?
Thank you, Governor. I'm Dave Jepson, the Director of the Idaho Department of Health and Welfare. I want to thank the Governor for his emergency declaration. As mentioned, this will allow access to additional important resources. The current focus of the working group is on protecting the health-compromised and elderly and to prevent or slow community spread to preserve healthcare capacity. The Governor's working group is in daily communication to support these goals. The communications include daily updates on global, national, and state-level situations. The working group is also focused on preparation in key areas, such as coordinating with hospitals and medical providers to ensure that they have what they need to provide the maximum healthcare capacity across the state. We've been working with federal partners to free up personal protective equipment, that's masks and gowns and gloves, for healthcare professionals across the state, as well as critical medical equipment, such as ventilators. The Governor's emergency declaration will clear the way with our federal partners for this to happen. The working group this week formed a subgroup that we're calling a strike team. This strike team will be focused on accelerating the existing work to protect the health-compromised and elderly. This is the vulnerable population that we're looking to protect, and each of us need to do our part to protect them. The best thing you can do to protect your family and friends who are health-compromised or elderly is to wash your hands, cover your coughs and sneezes, avoid others who are sick. And if you're feeling sick or have been around those that are, please do not expose those that are health-compromised or elderly. The working group is here to support the Governor and all Idahoans in our collective efforts to prevent or slow community spread, which will preserve healthcare capacity, and to protect the health-compromised and the elderly. The working group is helping Idaho to ensure that we are proactive and prepared for any situation that may occur with the coronavirus. I will now hand it over to Dr. Chris Hahn, our state epidemiologist.
Good morning. As you heard from the Governor, we do not have any known cases of coronavirus in Idaho at this time. And I emphasize that point again because we are getting a lot of questions and concerns that and rumors that there are positives that we are not revealing. We absolutely are committed at all levels to immediately report to the public as soon as we have our first positive case. Again, we get test results coming in every day, so it could be later today. We don't know, but we are continuing to test. We've now tested over 100 patients, I should say, not samples, 100 patients through our state public health laboratory. But what we really need, as the Governor alluded to, is the testing from the commercial sector to start ramping up. We started yesterday. We got our first results from private laboratories that we have mentioned before. They electronically report to us. That's great news. So we know the system's working. We're getting those results. They were all negative, which is also great news. But that is going to certainly increase greatly in the coming days. Our state lab has also adopted a more rapid process and added a second lab machine that they can now do under FDA agreement. That they're doing that as quickly as the FDA moves things forward. They are adapting these new technologies. Our state lab, though, as I mentioned, is somewhat limited, and we have had to prioritize the people who are seriously ill or who have very high chance of being positive, for example, recent return from a country with high disease rates. So we know we can't answer the entire need for Idaho, and we really need the private labs sector to increase the amount of testing that they're doing. So we will continue to work on this issue. Also, we need to do more, I think, to let people know where they can go to get tested. We get a lot of questions about that, and we are working to make sure, and we've been in communication even as late as this morning, communication with providers around the state, doctors from the various hospitals about how can we make sure people know where to go to get their test. It's not just a matter of having the lab test available, but where people know where they can go. And you may have heard this morning from the federal level, there's a growing emphasis from Dr. Fauci at the National Institutes of Health and others that they recognize there are some federal solutions that will help as well that we are going to look for their help. Secondly, and lastly, I just want to mention we understand with all the events being canceled around the country and in Idaho that people are looking to public health for guidance about that. Just yesterday on the coronavirus.idaho.gov website was posted a new guidance that was developed between the health and welfare and the district health departments. We are all in agreement on this guidance. And it includes recommendations on when to consider closing certain venues. We are not mandating anything at this time. Again, each district health department does have that authority, as does the state if needed. But right now, these are recommendations, and we'll direct you to that page. It's under the resources tab on that website. So please take a look at that. The recommendations are when might an event, for example, people coming from large number of people coming from out of state, or is it an event where there are a lot of elderly, vulnerable people that might be attending? Kind of those kinds of considerations for event planners and for communities to consider. And with that, I'll end. Thank you.
Questions? Scott.
Governor, sir, I've heard national health professionals, leading health professionals in our country say that the federal government's response, that they're flabbergasted because the federal government's response has been a failure. Have you perceived that here in Idaho?
No. Bill.
Can somebody talk about that map and why Idaho is one of the few states where there isn't red marks?
Well, I would say it's because we're a great state, but a lot of it's luck.
So as far as you know, we're not doing something that the other states aren't doing.
No, and you know, obviously Washington had the unfortunate circumstance of being there every day. The science on this issue and you know, what's the incubation period? Every day it changes. So we've had the great benefit and the fact that I've got a great Department of Health and Welfare and an epidemiologist and the whole healthcare people have been involved. We are putting things in place that I know the state of Washington would have loved to have had, and but some of it is just luck. But I'll take credit for it if that helps anyone. Yes, sir.
We had 3 Idaho lawmakers attend a conference in Maryland where they could have been exposed to COVID. Have they been tested and have they stayed home?
I don't believe they've been tested, but what I do know is we did talk to Maryland about the person that was at this conference and where they were, and I think in the conversations that took place, they were far enough away from them. But they were, you know, we asked them, we communicated with them as soon as we found out about them to be sure they self-assessed and sure they watch for any symptoms. But When these things happen, we reach out to the state healthcare people and say, okay, where were they? What was their exposure? And I don't think they had any direct connections with that individual. So.
But they haven't been tested.
No, they haven't been tested. James.
Governor, last week during the press conference, I believe Dr. Hahn said that the state had capacity to do 15 tests per day. A group of more than 20 national health officials from Harvard, top schools, top medical organizations as well say that 13% of cases are confirmed right now of coronavirus nationwide due to lack of testing. You said that the state is meeting testing needs, and those seem really incongruent. How can you say that the state is meeting testing needs when we only have 800 to 1,000 test kits and reagents available right now?
Well, Christine, do you want to talk about that?
Yeah, thank you for that question. To be clear, first of all, testing capacity has increased. I mentioned the new procedures and the new lab equipment that's being used. So I think yesterday we did 30 to 40. I don't have the exact number, but we have increased our testing. But I acknowledge, and I did acknowledge earlier, that it is not enough. We need private laboratories to jump in. We now have received results from 3 as of yesterday, so it's a rapidly changing thing. We acknowledge we should be testing more Idahoans. I think what the governor and I were referring to earlier is that our state lab has been able to test everything that's come to it. We have not had to put samples on backlog. That said, though, the message to the providers has been, hey, we have limited, capacity, so don't swamp us, don't overwhelm us. But so they've been sending us the sickest and the ones that they thought were highest at risk. So they know that the testing capacity has been somewhat limited, but that is changing as of Friday. Last Friday was the first day we had LabCorp come on board. Monday, Quest came on board. And earlier this week, we have our third laboratory. So it's really ARUP, so it's really changing very rapidly. We're in a tight pinch right now, but we think it's going to improve very quickly as these private labs come on board.
So do you think that you're going to be able to, because right now you're saying don't get tested unless you have all of these symptoms, and if you're asymptomatic but can still spread this, how can you say that you are going to follow this blue line right here that's trying to spread out the spread of the virus?
Right. Ideally, we would have from the get-go. You were asking earlier about the federal government. CDC did have a challenge with the testing rollout. There's no question about that. I think that is a problem. But we would like to do more testing. Right now, we have to focus on the sickest, and so we're asking those that aren't the sickest, who are maybe completely asymptomatic or who have a mild illness, that maybe they're not the highest priority. But again, that should change, and we hope it changes very soon.
What about schools? Are those going to be closed at any point, and what would that process look like?
Well, as I explained last time, the superintendents have the authority right now to close schools. That happens every year. The flu outbreak, and there's protocols in place that exist. Some states have done a statewide school closure. The issue is we don't know where we are, and if you close schools too early, then you might not be there at the right time. This is all an issue of timing to flatten that curve down. And then the other issue with school closures is they're not a panacea, because those kids go home and often they're being taken care of by their grandparents. So we wanted, if we do this, we have to do it at the right time, and the superintendent and the health districts and our committee will assess that and we do on a day-by-day basis.
Sir, what about churches and places of worship?
Madison, do you have a question?
Yeah, I was wondering, with the upcoming spring breaks and families and students traveling in and out of the state, do you worry that's going to cause a spike in the possibility that we will get cases?
Yes. Keith?
What help have you requested from the federal government, and what have you received?
Well, the stockpile, obviously having access to the stockpile, that's part of the reason I'm signing this declaration or proclamation today, is because it gives us more access. They've been, and I'll let Dave address it, but when we've had a request, we've got an answer. we all know, because of the magnitude of that map getting read so fast, that there's lots of demands that are being placed on the federal health care system. But, you know, our experience is they've been very receptive, you know, and they acknowledge this morning, as Dr. Hahn just alluded to, they've acknowledged that they were behind the curve on testing at the get-go. And Dave, do you want to talk about?
Sure. Thank you, Governor. Thank you for the question. As the Governor mentioned, the two big requests we've had are around equipment, personal protective equipment, and equipment we may need, such as ventilators, should we get into the top part of that curve. They have been very responsive. We obviously needed this action from the Governor to open up the door for us to access that equipment. But we know that they are actually ready, with even down to starting to talk about counts even ahead of this order of how many we need and how many we need to bring into the state. The other is there was federal legislation signed, I believe just last Friday, to free up some extra emergency funds, somewhere in the $8 billion range. Some of that money will be coming to Idaho. It's still working its way through the process. Unfortunately, we're in a good position where we don't need that money just yet. We don't have any cases. We're still in preparation phase. But they've been very helpful in us thinking through how we can use that money to put it where we need it, to make sure we're prepared and so we can respond quickly when we do have cases.
Bill?
Governor, when Idaho does have its first confirmed case, does that trigger any additional steps beyond what you're doing now?
It depends. It depends upon whether it's someone we know where they came from, they're already isolated, and Dr. Hahn can answer this better than I can, but in this accelerated class I've had on contagious diseases, it depends upon who it is. If we know where they've been, what they've done, that's one thing. But if it's actually the first community spread and the second community spread, that the numbers, the statistics, then we want to identify where we are on this curve. And that's part of the math that's being done with the committee that the director's got. Dr. Hahn, did I miss anything?
No, I think that's absolutely right.
Okay. Yes?
What would you tell employers who aren't offering paid sick leave right now and maybe having their employees in the workplace, especially if they're interfacing with the public?
You know, an entrepreneur, a business person, it's just good practice. I mean, everybody has to look at their individual business, that what's critical to them. And obviously, if you don't have paid leave and your people show up sick, it's just not good business practices. We're going to put together groups on large businesses, small businesses. I'm very concerned about the businesses that touch a lot of the public, and they darn sure shouldn't have people showing up for work. And if they don't have leave and it's a financial burden to them, I believe that bill that's rolling through Congress now, there may be some federal help in there, but it's just good business practices to do that. So, yeah.
Do you plan on suspending state travel?
We've already advised the agencies, and we're assessing that every day. Obviously, we're telling agencies that they shouldn't travel to somewhere on one of those big red dots that's on the map. But we're looking at that every day, what we do from state travel. Most states have done that.
Idahoans continue to rush out to the store and stock up on things. Some stores are reporting they're simply almost out of toilet paper and water. What do you say to the Idahoans that are rushing out and stocking up? Do they need to be doing that?
Well, they ought to think about their neighbors. You know, people that hoard things, you know, we've said from a best practices, it's always good to have a supply. The graph of this is 21 days. That's the science today, and I don't know that it's changed. And so, you know, probably doesn't hurt to have a supply. The one thing that I experienced when I went to the grocery store a week before last is how many people were ordering online and picking up their groceries at the store right there. Those our retailers that don't do that are going to be at a disadvantage, because if we get somewhere into this curve, there's going to be more and more of that and I know that the supply chain, but we're concerned about the whole supply chain. What happens if the truck drivers can't deliver? You know, they're trying to restock those shelves every day. So we're looking at this very holistically, but they should think of their neighbors if they're hoarding. If they're having a prudent supply, that's one thing, but they should think of their neighbors if they're hoarding, and they should think of me if they're profiteering off of it. Yeah. Joey?
Is any work being done to try to set up drive-through testing sites? I know some
We've talked about that. That's one of the things that other states have done. In my calls with other governors, with the vice president, that's one of the things we're talking about. Right now, we're just trying to get this testing done, but that's one of the things we're talking about. Is that fair, Doctor?
Is there a timeline?
ASAP. You know, at least having the options for it. So. Bill?
Governor, the state's a major employer in and of itself. Are your agency directors doing things to talk to employees
yes.
who work from home and options like that?
Yes, I'm perfecting the one-word answer with you, Bill.
Thank you.
James.
So you had said that you're kind of weighing and assessing until we get kind of a better idea of how many cases we might be dealing with, whether or not you'll take extra steps like limiting gatherings of over a certain amount of people, et cetera, et cetera. Are you concerned at all, or have you been weighing in your head, taking the examples of, say, China and South Korea, who immediately cracked down on that? They're seeing very few cases progressing day to day to day, whereas Italy just continues to explode. I mean, since we're in this situation right now, why not take those steps at this time?
Well, but that goes to what I thought I alluded to earlier, but I'll try and do it again. We don't know where we are, and that's every day we have to look at where we are about what we do. My goal is for everybody in Idaho to do the right thing from a standpoint. If we see places where the right thing's not happening, we'll assess it. But we gotta see where we are. Right now, we have no community spread that we know of.
But why not take the step right now to prevent that from even happening and take that out of the equation of people not doing the right thing, which we saw in Italy, people weren't doing the right thing?
Probably because we don't know if you shut everything down and you're not even on the starting place, there's going to be, you know, we have certain liberties in this country that they don't have in China. People are going to go out, and it might exacerbate. It may create. We want to aim for this lower graph and not the other graph. And if we do something at the wrong time, we might exacerbate it instead of prevent it. Scott.
Sir, what about churches, places of worship? What do you recommend for those gatherings?
Well, we obviously they can talk to their health district. They can talk to us. I know that in the church that I attend, we have hand sanitizer and that's there. But some of the events they have where they have big gatherings, particularly if there's community delivery of food, they need to assess it. And the health districts and health and welfare, we're there to give them the advice and counsel. So, yep.
Any discussions about prevention and preparations in terms of our prison system?
Yes.
What do those look like?
Well, these are things that happen at prisons every year. Matter of fact, today we've got part of our prisons that are shut down for the flu. They deal with this on an annual basis. This is a different bug than what they're used to, but this is standard operating procedure for a good corrections system. But it complicates it. But we're in conversations with Director T-Wall all the time about this. Keith?
A question for Dr. Hahn, if possible.
You bet. I'm dying to have her up.
So this graph doesn't contain any numbers. You've probably done some math. How many, about 1.8 million people in Idaho do you expect to be infected with the coronavirus?
Right. That's a great question about how many people we might expect. I'll tell you that what we are using right now and I'm sorry I just touched my face. I know it's going to go viral. I was explicitly told not to do that. I'm trying, people. I'm very trying. I know we all are. We are using different models to estimate, and the models that we are looking at start as 15% up to 35% of people ill, but we don't know. Really, Washington, when we think about all the differences of China compared to the United States, that I think we talked about last time a little bit, but a different population, a different healthcare system, and different methods of controlling outbreaks, we don't really know, and so we have a very wide range of estimates. We really don't know, but I'd say that the numbers that we've been mostly looking at is an estimated 15% of people ill. As the governor mentioned, many of those may be very mildly ill and not need to be hospitalized. So as we get more information from Washington and even from parts of Europe that we might say, well, that seems more comparable, we'll keep trying to refine that. But we are really, I was thinking that term, building the plane as we fly it, right? We are trying to have the right information to make sure we're headed in the right direction, but that is something that we are gathering now, really from Washington State and seeing what's happening there.
Bill?
This isn't a yes or no answer. Governor, what's the protocol for when the first confirmed case is identified and subsequent cases? What's the protocol for letting people know?
We will, as soon as we have a confirmed case. That's been our.
But I mean, does the announcement come from you? Does it come from the local health district?
The first person that'll get it will be the communications with Dr. Hahn's shop, and that's because the results will either come from our state lab or one of the other labs that she just said are electronically reporting to us. So we had a person in Idaho last week that had been someplace where they were quite exposed, and we got a negative back, but we were ready if that would have happened, but it was a negative. So, James?
This is a question for Dr. Hahn.
Good.
On the working group or within the working group, have there been discussions about coming up with extra plans when it comes to capacity issues? Since, I mean, Idaho's a very rural state. We only have so many hospital beds in total and fewer beds that are actually equipped to deal with these kinds of illnesses. How exactly will Idaho handle those cases, and what can we expect should that happen?
Yeah, that's a great question. And I just want to the question was about whether the working group is talking about it. Yes, they are, but that's not the starting point. In Department of Health and Welfare, we have preparedness group that has been working and exercising with the local communities and through the district health departments for years. We've had funding to get ready, and of course they're the same group that plan and prepare for I almost said hurricanes. That was not, but who plan for things like earthquakes and other disasters, right? So a lot of that work is ongoing. Is how are we going to handle it if a large number of people show up at the hospital? We had the same discussions around the if there was a big earthquake to hit in, Seattle area, how many people would come to Idaho? Those sorts of planning and work is going on all the time. So it's not just starting now, like, oh, what are we going to do? It's really been going on for a long time. And as I mentioned, I think our biggest challenge right now is estimating numbers of ill, because that's the big unknown for planning. The hospital groups are also working. I was on a call just this week with through the Idaho Hospital Association. All the hospitals were on talking about how they will work together, share resources.
So you said between 15 and 35% are kind of the models for how many people might get sick. Obviously, that doesn't mean they need hospitalization. Are you comfortable with the capacity that Idaho hospitals have in the state to effectively handle those?
Right. I would say that is, again, the big unknown, because if we have, again, I look at Washington State, we can't be too complacent. It's put a huge strain on their state, and they've been working very hard to adapt. I think we are learning a lot from Washington State, and one of the first things, this is going out today from our department, is a reminder to all the long-term care facilities and assisted living facilities in our state to notify us right away if they have a respiratory outbreak of any kind. They already do that routinely under state law. They are required to report, but as a reminder, don't delay, report to us right away, because we don't want to get to that point where we're stressing our capacity. Because I think, as you know, hospitals, they're running pretty full normally, right? So it is going to be a challenge. I don't want to downplay that.
And we are. Matter of fact, I saw something yesterday. We've had a low flu rate this year. We've been blessed that our flu rate is below average, and that's. But as I said earlier, we're trying to do two things. We're trying to move that line up. That's one of the things that this proclamation does, is make more healthcare workers. So we're trying to work it from both ends, flatten out the curve, and also work with all the healthcare providers to make sure that we've got enough capacity. So
if you look at 15% of the Idaho population and you assume that about 10% is kind of the low level of how many would need to be hospitalized, that's 25,500 people. We know we have 300 isolation rooms, and then you can add another 60 to that and potentially go outside of hospitals. But do we have enough ventilators for people? And if not, how are we going to handle that?
well, do you want to answer that, Dr. Hahn?
Yeah, I want to point out, you're right. As I acknowledge, we are concerned about our ability to handle everything, and that's why what the governor keeps emphasizing is so important. If everybody hits at once and everybody is flooding the hospitals at once, there's almost no way we could do that, right? So we are hoping that at one of our goals is to spread this out. If there is a wave of illnesses, the hospitals, the healthcare system will do a lot better job of handling this if it's not all at once and large numbers. So absolutely, that's part of it. You asked about isolation rooms, and I'll just make a point about that. Some of the hospitals do have isolation rooms, and some of the hospitals that we've been talking to actually have the capacity to add more isolation room by kind of I'll say flip of the switch, and that's obviously way too easy, but they can expand their isolation capacity in an emergency. They've been thinking about this for years. And there's also the possibility that not everybody would need to be put into isolation, that we might learn more about the virus over time and realize that we can treat people in different ways. So we will stay with the science and do the best we can for those patients.
What about ventilators?
Yeah, and ventilators, yes, we're tracking the number of ventilators in the state, and again, we can request more. That is part of the Strategic National Stockpile and the reason the governor issued the order.
Scott?
For Dr. Hahn, sir.
You bet.
Dr. Hahn, the state does not have the capacity right now to test everybody, right? So if I wanted to test right now, you'd have to prioritize. Secondly, is it possible someone can be asymptomatic and have COVID-19?
Yeah, so first of all, testing, the capacity to test, we tend to focus on what we have control over, which is our state public health lab that I mentioned has limited capacity. But with now 4 commercial laboratories out there serving Idaho, again, I mentioned one's just coming on board, and we already have results from 3 of those labs. There should be enough capacity to test people. I think where our bottleneck is right now, and I alluded to this earlier, is people knowing where to go to seek testing and making sure we've got people knowing how to get tested. So I think that's growing because of the addition of the commercial sector. And then you asked me about can people be asymptomatic? That was your question, right? Yes, we know that some people get infected and never know it, never get sick. And the thinking is that they are probably not a main source of transmission to others. But there's some science that suggests that can potentially happen. We're treating it as if it can happen, right? That's one reason we put people in quarantine who are asymptomatic, potentially like the federal government did with the people coming in from China. Even though they felt well, they were held in quarantine because they're asymptomatic, but could they possibly pose a risk or develop illness down the road?
Just a quick follow-up. These 4 commercial labs, are they in Idaho?
No, all the commercial labs we use are in the region. In Utah, Washington State, so there are kind of a neighbor states, but these are labs that our hospitals already have relationships with and already routinely send lots of samples to. So they're already used to working with these labs. It's just a matter of getting these tests shipped that way as well.
Yes, sir.
Is there any consideration of a state plan for childcare?
Those are some of we're looking at all the weak links we've got in our system. And but obviously, you know, taking anybody and putting them together, our desire is to spread them out, to have that spreading to where there's not so much of it. So that's one of the things you have to, what's the alternative? What's the alternative? Idaho's probably got a much higher percent of people that have friends and family here that can assist. When a school district closes, the issue is where do they go? And of course, one of the things that probably most important to me is my healthcare workers. What's available for them if the schools here around Luke's and Al's in this valley, just as an example, closed down? You know, what's going to be available? So, do you want to talk about that, Sherry?
So just really quickly on that line, the new guidance from the CDC today was actually that schools practice more of hand washing and those practical matters at this time. And the governor mentioned earlier that that's a local control issue, but they are urging schools to, rather than close for Idaho, they are urging us and across the nation to just talk to kids about hand washing and hygiene like we are with adults. Don't touch your face and things of that nature. So.
Superintendent, just kind of as a follow-up, can you talk about the conversations you've been having with districts and in your mind, is there a specific thing that would trigger you to say, okay, we need to start closing school?
Thank you for that question. We did have a teleconference yesterday with superintendents to make sure that they are being proactive. We had that conversation about not being reactive but proactive and having a plan in place, making sure that services to kids are not disrupted. And so we had a great partnership with Idaho Digital Learning Academy come to that yesterday and talk about all the different ways that we can serve children should there be a school closure, that life will go on. You know, we talked about connectivity issues and the fact that a lot of Idaho is rural and how we could service those kids still. And schools have shared with me, several of them have plans for drop-off points and pick-up points for homework and things like that for the smaller students who wouldn't be appropriate for them to go online. And so there are plans in place. We're still working with them. Some of the concerns were around testing. You know, the testing window or the ISAT is coming up, and so what about that? And we are still waiting for federal guidance, and what we learned is that they are going to give waivers to individual schools who might need to close, so that was good news. And so I feel good that school superintendents are being well informed. We're keeping them up to date and making sure that they all of the information that we are sending them is going through our state site. And I told them as soon as they know something or need to close, to make sure we're sending out guidance about letting me know that, so that the coronavirus working group is aware if a school at this time decides to close. But again, working closely with the governor on that, and the guidance right now is stay open and practice more of the common sense measures, wash your hands, cover your mouth, things like that.
The sound of it, though, is that you're going to let individual districts make the decision about do they close or not close.
At this time, like the governor mentioned earlier, yes, that is a local decision. Now that may change, but we'll keep everybody well informed.
Yeah, Superintendent, just to follow up along those lines, if it did get to a point of a statewide closure, like Oregon or any of these other states, based on infrastructure and devices, do we know what capacity we have statewide to do online learning?
So yeah, Clark, that's a really good question. That was a concern yesterday, and that's why we had the Idaho Digital Learning Academy there with us. They have partnered with us. They are offering free services. They had a webinar for school districts yesterday at 2 o'clock talking about what they can do for students. And so there were some concerns about connectivity. We're waiting to hear from the feds to see if there will be any extra dollars for those students. But what we heard yesterday is, you know, kids, most of them have a mobile device and can access any of these assignments via a phone, a cell phone. So we were feeling pretty comfortable about that. And the schools who were worried about it were having plans in place to drop off assignments, pick up assignments. We're still talking to districts about that and offering our services as a state Department of Education. What can we do to help you? Please call us. The majority of school districts have a plan, and the majority of them said that they are able to provide services online. They can use their title funds, which is funds they get from the federal government, to supplement anything as far as devices or online. And so we're continuing to keep in contact with them and making sure that life will go on for kids. We gave them guidance around meals because, you know, students of poverty often, that's the only time they get a healthy meals at school. So we have some guidance around how we can do drop-off packets and pick up meals and things like that. Again, making sure that life goes on for kids, even if in the event that we have a massive closure.
Yes.
Do local health districts have material in Spanish or other languages that would be key for like our refugees in Boise? Are they distributing them, and where? If not, are they relying on local organizations to do that for them?
Yeah, so thank you for that question. I remember you brought that up last time, and it's a very important point. You know, our health districts really vary. Some of the health districts have a larger population with various different languages, and I know they are working on that issue, but you'd have to refer to them directly. I'm not sure where each of them is at, but I appreciate you bringing that up. We do need to make sure we are continuing to make sure people that speak different languages are also getting the information they need.
That's taking place right now, but I'm not sure how broad it is.
What do you mean by that?
I mean, that information's being put out, bilingual information's being put out right now. Yes, Joe.
For Dr. Hahn, is there any indication on when the state will get more tests, and if so, how many more can be expected in the next week, the next month?
Right. So just a few things you've probably heard. I think out of Los Angeles, they were reporting that they didn't get all the reagents they needed, the materials to do the testing. Our lab has said that is not a problem for the way that we're doing the testing. So we actually are confident we should be able to continue to get everything we need, even as we see an increase in demand. And as I mentioned, though, I want to keep emphasizing, I think the testing burden, really most of it's going to shift to the private sector as these guys get up and rolling. They can do probably vastly more than our state lab can do. But yeah, we feel confident, as confident as we can be in these difficult times, that we have enough to test for now, and we'll continue to get supplies.
Yeah.
Probably for Dr. Hahn again. I know with the influenza, there's typically a season every year. Is there any indication that there's a seasonal thing with this COVID, or is there not enough information right now? Right.
There's not enough information. We are hoping there's a season because we might see a drop-off in the spring. But I saw a worrisome report from Australia. We all heard about Tom Hanks, that usually we see flu in the winter time, our winter time, and they'll see flu in their winter time. And if they're seeing the virus this time of year, is that an early indicator that we're not going to see that seasonal? That's the question. But we really won't know until the time comes.
Yes.
Governor, are there any specific concerns for more rural or remote areas of the state where healthcare is not as accessible, where maybe the nearest hospital is 2 or 3 towns away? Are there any specific considerations for the more rural areas?
Dave, do you want to talk about that?
Sure. Thank you for the question. That's always a concern, is making sure that all citizens in the state, whether urban or rural, have access to the health care they need, and that certainly is the situation here. I can say, and there was meetings this week with all of the CEOs of all the hospitals around the state, and as Dr. Hahn said earlier, the hospitals have plans in place for all kinds of eventualities, emergency situations that could drive large numbers of patients to their facilities. And that's actually always the case for the rural hospitals as well. The very good news in Idaho is we're a very friendly state, which means our hospitals get along well. And on the call earlier this week, where they were talking through their plans with us, the department, it's very clear that they have plans in place and they have ability to share resources, transport, stay in communication, and manage the capacity as needed. So where one hospital may not have a facility or an ability to do something, they have a clear plan of what they're going to do to deal with that. But it's always a concern in the rural areas that we make sure we have the services that are needed for the individuals there. And hopefully it's a little easier in the rural areas to stay spread out. Maybe that'll help them prevent the spread a little bit, but we are prepared in the rural areas as well as the urban areas.
Yeah.
Have you had any conversations with the legislature about expediting the end of the session?
Yes.
What are those conversations? What do those look like?
I think there was ample reports yesterday. I think leadership on both sides are their goal is to, we're close to their designated go home date already, and occasionally that moves a little bit. But I think the urgency because of this particular issue has gone up, and they're very sincere about it. Okay, Scott.
Sir, any thought about possibly closing the State House to public access?
There's not a facility in the state that, given a certain set of circumstances, if it's for the betterment of the public health, we will consider. Probably the first thing we'll do is do signage about if you're not feeling well, like where was I? I was somewhere last night and they had that sign on the front door. That's just good practice everywhere. We have a moral obligation, because this is the people's house, to have people come in. I had a conversation with leadership of the legislature about tours, our student tours that are here, and they were going to discuss it. But I mean, it's just the right thing to do. It's just good health practices whenever you have some kind of an issue like this. Yeah.
For Dr. Hahn, is there a timeline on when everyone will be able to get tested, not just having to hit a certain threshold of symptoms?
I'm going to adopt the governor's style and just say no. There's too much uncertainty right now to predict that.
But it goes to those graphs about, if you test everybody, that's only good for, maybe 18 to 20 days. So does that mean you have enough to do everybody every 18 or 20 days? So, okay, I guess I better sign this proclamation. Secretary of State has already signed it. Thank you, Lawrence. Oh, Lawrence, if you got a second, before we leave, just so you know, yesterday I submitted sent to Emmett my request for an absentee ballot for the May primary. You all know when you go to vote, there's a few people that work in those polling places that are older than the average Idahoan. And so I know that the Secretary of State's got a lot going on, but we will be in contact with the Secretary of State about what we need to do. Lawrence, have you got, but you've been having discussions, yeah, you and your team have been having discussions, so that's probably one of the next things we'll have to talk about. So, okay, thank you very much.